I will start by welcoming you to this first Kigali debate of 2021 on the theme social protection strategies and the new Ubudehe categories. What should citizens expect? And with that, I will just give the floor to Dr. Eric Ndushabandi for his introduction as we get going.
Thank you very much. Happy New Year to everyone. I'm happy that we can have our very first Kigali debate and opening our dialogue space for 2021. You know, civil society organizations have been somehow intervening, maybe late, not always at the beginning of the initiation or inception of the policy. Generally, in a traditional way, civil society organization coming just to evaluate later. Next is now, what can we do now? What is going on? These are our main questions. So it is very important to go and to contribute to this debate from the beginning and see what are the gaps or the remaining gaps and the challenges. As we are ready now after registration, maybe this list of people have been registering in categories. So what can citizens really expect from these categories? So I say, let's open this dialogue. There's no protocols. Thank you very much and welcome.
So Mr. Saidi, I'm now going to give you the floor for your presentation.
In 2015, we reviewed our categories. Here I can say that as the government of Rwanda is developing, some criteria of categorizing people also are changing. So it will just be said, why just you can continue having like 6 categories where some of them they can match and the others cannot match, and you can continue maybe having like reviewing our categorization and reviewing also categorization criteria. In 2020, we come with new thinking, how we can review our categories, how we can maybe coming with new criteria, categorization criteria. And in this perspective, you have 5 categories. And you have also changed, in lieu of having numbers, we changed to go to alphabetic, where category A, it is people living above of extreme poverty. Even category B, category C and B is considered as people living under poverty line, and the category E, it is considered with the special groups. It is a special group because it is the people who cannot even graduate from poverty, where the government should continue supporting them. So that is another different from former categorization of 2015 to new categorization of 2020. And one of criteria of categorization, we used also, we tried maybe to see how just we can make a difference between urban and the rural household characteristics. Some people in the rural area has criticized our former categorized, saying the criteria we used is not making a difference between rural area and the urban area, because different criteria in the urban area, because they have different opportunities, the land in the urban area cannot having the same cost in the rural area. So in this way, we tried in new categorization to make this different between urban and rural household characteristics, especially from income and productive asset. Another one, we wanted this categorization being community-based. It's meaning whatever we can bring some standard, we wanted that this categorization to be community-based, to be done by community, to be done at village level. I want also to mention, we are not categorizing people, we are categorizing household. When we are categorizing household, we have some household who cannot change their lives because their standard of living, who cannot graduate from that categories, who should be supported by the government. We needed in that exercise to know those people, those special group, to ensure that when just we are supporting, especially in social protection, we know where to intervene. So that is another another new thinking in this new categorization. Those information we are collecting, it is helping not only Rwanda, not only Ministry of Local Government, but other government institutions to use those information in planning. Another point, we want to know each other as a household, how also we can support each other. It's where just we are using those Ubudehe categorization and Ubudehe information in Virtueller Politikdialog, this community health program. It is helping us to stimulate the implementation of social protection programs, and also to know, because we have introduced performance contract, household performance contract, we want to know how people they are graduating, they are changing their lives, how people they are committed to shift from category to another category. It is helping us to fight for the dependence mindset. So this is some criteria. It is not only criteria we are using, but it's giving us the general criteria, where category 1 is people above of people who are getting on monthly salary more than 600,000. Maybe they can have also source of income from productive asset more above of 600 and so on. And the land size, it is above of 10 hectare in rural area and 1 hectare in the urban area. And the category B, it is people who are belonging, especially on source of income from productive assets between 65,000 to 600,000. So I want maybe to bring some information about this special category, category A, where most of social protection programs, they can intervene because it is people with no labor capacity. They don't have any income, and also they don't have labor capacity because of their age, because of their severe disability, because of their under 18. It was just we said it as having like a special category, household categories, which the government can support during their lives or during their circle. We worked together with the different government institutions, with the civil society organization, with the churches, with the communities. We worked with the local government institution. We collect information, special groups at local level. I mean, women association, young association, opinion leaders. We worked with the media, and we gathered together information which has really generated the current Ubudehe categorization. We are now in the third phase of data quality assurance, and also for those missing household, we go back there to collect some information. After that one, we are going to data analysis, and after data analysis, we are coming back to the community for appeals process. After having completing this exercise, we can maybe starting really reporting exercise and going to the validation process. And after that one, if our report it is accepted, all of data collected should be migrated in our MIS, in our database, and we can start using it.
I want to draw my thinking from a study that LDP has conducted at the University of Manchester, which was focusing on distributing social transfers in Rwanda, the case of Vision 2020 Umurenge program. In what follows, I want to highlight 3 key findings and link this to citizens' expectations towards the new Ubudehe categories. In our study, we found that there is a tension between the productive and the protective role of social protection, especially when it comes to performance contracts. So the central tension was the question of whether people should be selected for the work based on their vulnerability and need for support, or on the labor requirements of a particular project, which might necessitate, for example, that comparatively better off able-bodied people are hired in order to build roads quickly, The result is that the focus on infrastructure development in the imihigo can lead to the recruitment of those outside the lower categories, potentially undermining the protective role of the program. Simply put, what citizens expect with the new categories is that the protective role of social protection be preserved. In other words, with the new categories, citizens expect to see the VUP social protection reach the intended target group, Rwanda poorest, instead of satisfying the ambitions of performance contracts where there is a tendency to demonstrate the number of those who have received money, but also the pressure to repay, to recoup the loans. Our study also found that the protective role was undermined by restriction of freedoms and movement. There are rumors circulating that those in lower categories might not be allowed to get a passport or other travel documents. But also we found that lower categories were associated with some sense of lack of dignity, a sense of stigma and shame, all of which associated with the lowest category. Citizens expect new Ubudehe categories to bring clarity on some of these issues and confirm whether they are simply rumors or hold some substance. The third finding I want to share is that our study found that the community-based targeting in the categorization process was undermined by the proximity test, which in the current categorization process has been termed profiling, how these two processes will be working together. Citizens expect that new categories will reflect the information they shared during community meetings in Heko z'abaturage.
Profiling, it is helping to quality assurance, to know exactly if people they are categorizing people, if really the information we collected in profiling, it is the same information in how people they are working, they are analyzing social welfare of the household. It is working together, but profiling, it is providing more information. Normally, Ubudehe categorization also, it is helping profiling to know if just maybe we are having some information of people we have already categorized, and using profiling, we can even just cross-checking. It is like another mechanism of cross-checking of our data we are using.
Are citizens aware of the purposes of these categories? There should be a ministerial order which should specify ways in which these categories should be used and what purposes they should serve.
We went on the ground. We worked together with the community. We asked feedback, different media and the civil society organization, different views on Ubudehe, on current Ubudehe categorization. The intention, it is to help different programs to have basis information using social mapping mechanism. Ministry of Local Government is drafting a ministerial order which is going to highlight how Ubudehe categorization is going to be used. We have put in place a committee which is going to assess the requests for different programs who want to use Ubudehe categorization. They have to submit to that committee a concept note explaining why and the reason and how those Ubudehe categorization will be used.
Is there any officially known and in place monitoring and evaluation mechanism tool which would allow to know the graduation process and the pace of this graduation?
We are now having with UNICEF another study to know how we are going to come with monitoring mechanism to know how people they are graduating from poverty using social mapping also. Not census, because statistics will continue having those information, but as implementers, as the Ministry of Local Government, as implementers, we want to know before having those research what we can do. We need having like administrative data.
what do new Ubudehe categories mean for university students? We have a similar question from Emmaus from Rwanda Women's Network, who was asking, there is a number of services built on 2015 Ubudehe categorization section like Mutuelle de Santé, Ejoheza, social protection. What is their future?
There are some services really we are not really being linked to Ubudehe categorization, like education, like Basel university fees. It is no longer, it has really in the cabinet paper has been really clear that we are not going, once again, using Ubudehe categorization in education scheme, especially at university level.
Another question from Flavien, Rwanda Women's Network, basing on earning income where people earning between 65,000 and 600,000 Rwandan francs are in the same category. Is this fair?
It has been calculated according to the economy for Rwanda. According to our national revenues, our GDP, it is calculated around 700 to 800. It's meaning, if just you are calculating annually, it is people who can get around $12,000 per year. So it's meaning, if just you are calculating that 800, and we have people who are getting between 600, and they are above of national average. It's meaning those people, according to our national economy, people they are not really under poverty line. It's meaning annually they can get around 18 million. It's beyond of our average of our GDP.
Was the one of the focus of the maybe of this policy move is as they say, to the mindset change. The community themselves they have a role to play, but the service provider who also at the local level drive this process to support the community the way they need to support each other, but also to accompany the process of social protection. Maybe how the capacity building of these different stakeholders in terms of how they follow this process, they understand the categories, but also they predict how they can use them in a way that even the different programs that are put in place by the government can really deliver the expected policy objective. Capacity building, really we are doing capacity building according to the target group. Target group, I mean, we have tried maybe to establish e-learning platform for community where they can get information, but also we have downloaded from this e-learning platform some videos which is explaining how people they can categorize themselves, has been shared on WhatsApp, on other social media, in order just to reach more people. Another capacity building for community has been really done through radio, through media, through another tools to build the capacities of people. But we have organized different sessions for civil society organization, for media to explain them. It is training. We organize a 3 days training for social, for media, for civil society organization to build their capacities. We have organized also another different session for government leaders. But I cannot say things has been done 100%. Where we find there are some weaknesses, we are ready to correct. We are ready to see how just can be improved. We are government where we need feedback. Government where we need the comments. We are government where we need to correct, to improve where it is necessary.
Yes, we have one interesting recommendation from Dr. Ibrahim of GIZ. He says that his opinion is that there is a need for local people to actively participate in this Ubudehe category and feel free to categorize their fellows based on their wealth status. Finally, government and partners should mobilize and sensitize people on Ubudehe category essence and how as a tool will be used.
The need to have this ministerial order which really explains the use and the non-use of these categories could come up as quick as possible, or could be speed up, so that citizens realign in the understanding of these categories to this ministerial order.
in the programming of this, as in the practice, how it was conducted, the rolling, we've seen that at some time, we've seen that the people were involved, especially the local government, the local leaders or grassroots leaders, we've seen that in some area, especially like in the city of Kigali, we've seen that the period was extended to some, actually to address some of the challenge, some people who have limited time maybe to participate in these community meetings or even to meet the enumerators. So maybe I think maybe to some extent there is need maybe to consider the programming way of it to see how these different challenges can be also considered in the near future. Of course, I think the database needs some updates over time.
This was really a very good model, good example of partnership. That would probably to conclude ask Minaloc to share these best practices with the other ministries who design other policies to see that partnership involving civil society is more lead to more better results than going alone.
I appreciate it so much. It is forum. It is good forum. I have never seen it because really they are bringing a good question. Maybe for the new categorization, I'm going to ask Eric to organize this session because really you can collect another information which maybe can helping us to review for future Ubudehe categorization. Thank you.
So I will now give the floor to Claude Muhire from FES for his closing remarks. And I will just thank everyone for the very, very active engagement with the topic and the very interesting discussions. So thanks a lot.
Thank you so very much, everyone, for your participation. Sandra, thank you very much for always your wonderful moderation. A special thank you to Saidi for such a candid presentation. Dr. Sylvester, thank you so very much for your openness and for, catalyzing such a conversation and more importantly, for asking those good questions. As always, this is a monthly rendezvous. Very special thank you to Dr. Eric and the entire ERDP team, FES, everyone who participated. And I have to admit that this is one of the best debates we have had. This is a timely debate to talk about Ubudehe and social protection strategies. We can't thank enough Minaloc as our main partner, as well as LODA for putting together the social protection strategy that responds to poverty-related issues. I think we all agree that this is, a timely debate to understand more especially the distinctions between the old Ubudehe and the new categorization. Special considerations were traced to collective efforts to consider community satisfaction and community participation during this exercise of new Ubudehe categorization. The role of media and civil society involvement during awareness and the collecting feedback from citizens as the main beneficiaries of the Ubudehe categories. Once again, on the behalf of FES and ERDP, I want to say big thank you for all of you for joining this debate, for making it more participatory, for contributing. As I said earlier, it's a monthly rendezvous. We make sure we keep you on the invitation to ensure that, this kind of discussions, this kind of participatory approaches, this kind of platforms that, talk about the life of our people are also a continuous process. Thank you very much, and looking forward to other more engaging conversations.